excellent results with that. Do you have any breathing issues?
No,
Nothing.
not at all.
Awesome. Okay. Yeah. So we can reduce the width of the nose, increase the projection, give a slightly better tip, little bit narrowing, not a lot. Actually, more than narrowing the shape of the orifice, we can change. And this one, it's inside, so we can bring it a little outside, make it little bit more.
Yeah, I just want subtle changes.
Yes.
Not, you know, like
Yeah, not lots.
where I
But the change in the chin will be more than the change in the nose,
okay.
right? And this will also tighten these areas.
Yeah.
So you'll have a nice, good jawline, everything.
Yeah, I have these nasolabial lines.
That will reduce.
Yeah. Grow.
थोड़ा सा कम होगा
Okay, fine.
with the surgery. And when would you want me to do these things?
Actually, I'm going to Australia in August. So after that, I was thinking immediately after coming back.
Okay,
from there.
so you will be back like in November or October?
No, in August only. Like last week of August, I'll be here. But then I'll have to plan because I'm coming from Delhi, so I'll have to plan accordingly. But whenever the time, I mean, whatever the time suits you, I'll plan accordingly.
But you should let us know the window period.
Okay.
Matlab, if you tell us कि we want in August or I want in July or want in September, we'll give you a date.
August to September. I mean,
ठीक
these
है.
2 months I
तो
can.
August end is good?
Yeah.
Okay, no problem. We'll have dates August end. इनको अगस्त एंड में डेट देना है, आज ही कंफर्म देके स्लिप भी देना है, रिजल्ट्स भी बताना है, कंप्यूटर में एंटर होना है, ठीक है ना? एंड यू गोइंग बैक टू दिल्ली टुडे? Okay, cool. So in that case, I don't think you need to do any investigations because you're healthy.
Yeah.
We'll run the blood test just only before you come down for surgery. Now you've understood what all we can do. There's no risk involved. You'll have to plan to stay with us for about 5 days in the hospital, another 3 or 4 days nearby in our city. So we do a final checkup around day 9, day 10, and then you can go. Okay. There will be some stitches here and here and here and one stitch here. So those we will remove.
It won't scar?
No, it won't scar. And most likely we may not take rib for you. Most likely. In case we harvest rib, there will be some sutures that we'll take off from the chest also. The chin, no sutures will be removed. All are dissolvable sutures. Everything will be inside the mouth. You'll not have to bother about it at all. With regards to diet, you'll be asked to take soft solid diet for 2 days or something, liquid diet for 2 days.
That's completely okay. I'm on to very strict diet because I'm losing a little bit of weight.
Okay.
That's completely okay.
So that will help.
Yeah, that will help. Yeah, actually it will.
People do complain saying, doctor surgery के बाद तो मेरा 2 और किलो भी चले गए.
नहीं, that would be like
added benefit for you.
Yeah,
that will happen.
Yeah.
And then it will be 3 weeks or so before you can start eating normal food. 3 weeks, like chewy food.
After that, when can I go back to normal life? Like when can I go back to my work? Because usually
What kind
I do
of
field work. I'm a PhD scholar.
Wow, awesome.
Yeah.
So you're the real doctor.
Not kind of.
So
like in Friends when they say Ross, he's a doctor. Not exactly a doctor. I'm doing PhD from history.
Oh, okay, history.
Yeah.
Very nice.
Yeah.
Any particular historical?
Environmental history.
Environmental history.
Yeah.
Okay, so that means you work mostly in the computer or you go outside in the field?
I go outside because I've taken the topic of Garhwal region. I'm from Uttarakhand.
Okay.
So I usually go there for field.
Then you should delay that kind of work for 3
for
weeks.
A month or so?
Yeah, better.
Okay, I can do that.
3 weeks,
Yeah. Okay.
better.
Okay.
Mild walking side is all right, but
Sure.
lot of exertion, dust and heat.
Exercise and all that I cannot do for good 1 month.
I think so, 3 weeks at least.
Okay, fine.
ठीक है?
We'll do that.
August, look for some Monday towards the end of August, which is free. Ask Richo and then give.
And in case, if in any case I want to reschedule it.
Easily.
Okay.
You just have to call and tell them that this was my date that was given. I would like to come in 2 months later or cancel. Anything is possible.
Okay.
But let us know so that we can give the date to someone else.
Definitely, yeah, definitely.
ठीक है?
Okay.
See you soon then.
Okay, thank you.